back pain, people with severe back pain will need narcotics?
Oh, that's a bad one. I'm glad you asked that question. Look, let's say you wake up in pain. You take a narcotic. It's going to make you feel better. And then the next day comes and you wake up in pain again.
And you take another one.
You take another one. And what if a third day comes? Is that the day when you're going to say, nah, today I feel like being in pain? That day never happens. You just continue taking narcotics.
Until you're just dependent on them.
You got it. Withdrawal, tolerance, and dependence happens with absolutely everyone. I tell my patients this real sad story about my teacher's, one of my professor's sisters, who was an orthopedic surgeon, who had an ankle sprain, and she had to go to work. So she started taking narcotics. And she committed suicide about 10 years later because 10 years she couldn't get off narcotics. And as a physician, that's a person who knows the risks of taking narcotic pain medication. Narcotics are reasonable when there's a fracture, because that fracture will get better.
Right.
Narcotics are reasonable after surgery, because the surgical pain will reliably and quickly get better. Narcotics are absolutely contraindicated. Not a good idea for chronic low back pain. Now, doc, I only have 2-3 days of back pain. How do you know if it's chronic? We don't know.
We don't know.
Which is why my main message is that you gotta have a diagnosis. If you know that this is something no big deal, okay, it's reasonable to take 2-3 days of narcotics. Not my favorite way of treating problems,
right,
but it's not unreasonable. That's pain medicine. If this is something that's not going to go away, if you don't have a clear idea that this is self-limited or this is going to be something corrected a week from now with a surgical intervention, don't take narcotics.
So do you prescribe narcotics after a surgery for any of your patients?
Sure, for about a day or two.
That's it?
That's it. I mean, they can have more for a bigger operation. I mean, I'm a human being.
Right.
But still, with a surgical intervention, there's going to be surgical pain. But that pain is self-limited.
Right, it goes away.
It will go away quickly. Not enough time to develop tolerance, withdrawal, or dependency on the narcotics.